An annual report card released this week, by the March of Dimes, gives another bad grade to the U.S. when it comes to maternal and infant health, calling preterm birth rates a crisis in our country. We're joined by OBGYN and 11Alive medical expert Sujatha Reddy. Welcome to the show.
Thanks, Chesley.
Yeah, I think this is the first time we had you on the show. Glad you're here. All right, so tell us what factors is driving the U.S. preterm birth rates and contributing to this fourth consecutive D+ grade?
Yeah, our preterm birth rates are higher than they really should be, but they've remained kind of stable for the last couple of years. And, we've talked about this when we talk about maternal health, but there's absolutely a racial disparity when it comes to access to health care and maternal care. So, we're seeing that come out now in preterm births, not just maternal mortality. So, there's a few risk factors as well. Lower socioeconomic status is a risk factor, being under 17 or over 35. Having had one preterm delivery before puts you at risk. Chronic health conditions, high blood pressure, diabetes can also put you at risk. Smoking, things like that also. So, we are not doing very well. I guess the only silver lining is it's not going up. But I think one big thing we need to focus on is availability and access to health care, especially prenatal care.
Is that why we talk about the racial disparities? Talk to me about that a little bit. Apparently preterm births are worsening in that particular area. What does the data say and show us about the outcomes for Black mothers and babies?
Yeah, so African Americans have a very higher rate than non-African Americans compared to Caucasians, et cetera, when it comes to preterm delivery. So yeah, I think, the systemic racism in medicine is definitely one contributing factor. I think we're trying to improve that, but we've got a long way to go.
Well, are there any policy changes, or what are the policy changes, such as Medicaid expansion, does the March of Dimes believe are most critical when it comes to improving these outcomes?
Yeah, Medicaid has been a great thing for pregnancy as far as OB care, because several years ago, if you were pregnant and depending obviously on qualifications, you could get emergency Medicaid, and that's in every state, including Georgia. So that allowed women who didn't have insurance, if they got pregnant, to get access to prenatal care. I think that was a big thing that happened, but we could obviously do better. We need to get more women into that care. We still have healthcare deserts all over the country and in Georgia. So I think that's something to think about. But for sure, Medicaid has given women who didn't have insurance access to prenatal care.
You talk about these deserts, right? There is a mom-baby mobile health center. Has that made a dent at all, or is it still just we don't have enough of them or something?
100% what you don't have enough of them. It's a great idea. It's basically a mobile prenatal clinic. They also do well women exams, so just general GYN care as well. But we don't have that in Georgia yet. They're in conjunction with the March of Dimes. A lot of them are done in conjunction with the healthcare system. So perhaps that's in our future here in Georgia, but that is trying to get the health care to where the women are living, if it's in a rural area, or if they're in a place where they have health care but don't have a way to get there. There's a lot of things to think about. But those are sort of mobile house call units. And if you ever watched that show, Call the Midwife, back in the 50s and 40s in England, that's what they did. The women went to the midwives, went to the pregnant women, and that's what these mobile mother and baby units are trying to do. So I think it's a great idea. We just need more of them for sure.
Yeah, I got about 30 seconds left, Dr. Reddy. If you could sit before lawmakers and kind of give them some advice or let them know about this situation, what would you say?
Yeah, I think the most important thing is to increase access to health care for our moms and our children. If you can't take care of your pregnant women and your children, society is failing.
Absolutely. Dr. Reddy, thanks so much for joining us. Thanks so much for your insight.
Thanks, Chesley.
All right, take care.